Hi everyone, my name is Amelia Martinez and I want to first thank you for your time. As you know, we are starting to develop a wonderful program catered for children at our facility. Although there are different approaches to helping children in need, I would like to present the approach of attachment-focused family play therapy to be utilized. I believe this treatment model is beneficial to both children and families. It integrates the powers of play therapy and expressive therapies to understand the complex issues within the family while also taking into consideration various developmental needs of family members using a neurobiology framework. So first, I'd like to go into the background of the theory. The major theorist for this type of play therapy is Kathy Spooner, who's also written the book that's on the screen, Attachment-Focused Family Play Therapy. She's a licensed clinical social worker and a registered play therapy supervisor. She primarily works with children, adolescents, and adults who are going through different issues such as trauma, attachment issues, as well as depression, anxiety, and behavioral problems. The therapy model is heavily influenced by attachment theory, which was studied by John Bowlby and Mary Ainsworth. They studied the role of attachment in child development. Mary Ainsworth identified three types of attachment styles: secure, anxious avoidant, and anxious ambivalent. And then later, the attachment style of disorganized was added by Mary Main and Judith Solomon. Learning about early development of social bonds between parents and children on the basis of social, emotional, cognitive, and physical development of children has been significant when working with kids. There are three major components that make up this model. The first is neuroscience. Brain wiring begins to develop in utero and it's shaped by experiences. And if these experiences are traumatic, it could be hardwired in the brain. Also, attachment theory, which explores the quality of the relationship between the caregiver and child and its effects on social development, emotional development, and its regulation. And the last is family systems theory, which focuses on the interactions between family members and their communication patterns. Um, Kathy Spooner also noted guiding principles, which are families are generationally complex. Children innately desire to have a positive relationship with their parents and feel connected to their siblings. Next is children thrive when they have a positive, loving relationship with parents that's balanced with structure and limit setting. Parents provide the foundation for developing a healthy sense of self and developing a sense of security. An effective parent is a self-aware parent. Parents provide the foundation for learning to regulate emotions. And lastly, our biology directs our behavior and is heavily influenced by environment. So what are the major concepts of this theory? Well, it explores how the quality of the relationship between parent or caretaker and the child influences the child's social emotional development, emotional regulation, and their ability to form healthy relationships. From a neurobiology standpoint, attachment is considered a basic, inborn, biologically adaptive motivational system. Within this model theory, the way to target the problems is to utilize what's called family space, which is an acronym for the FAVE main attachment skills. Understanding these skills is beneficial as we will be teaching it to our clients as parents to help them create healthy relationships in their family. So S, structure and flexibility; P, playfulness; A, awareness and present; C, curiosity; E, empathy and acceptance. The three R's are the mechanisms to help attain the SPACE framework, which stand for reflexive communication, regulate emotions, and repair. So in order for this model theory to come to light, certain toys and materials will be needed for the activities for the children. So for example, we would need a sand tray and small figurines to utilize sand play therapy. This can be utilized to help children play out their emotions and memories if they have trouble verbally expressing it. Balloons is always beneficial. It could foster teamwork within the family. If we were to play a collective game. Um, Variety of art materials would be necessary, such as pens, markers, crayons, construction paper, scissors. Art therapy is essential to help children express themselves when they cannot do it verbally. one of the games that has been very significant is Family Aquarium, where family members draw themselves in terms of fishes and represent themselves within the aquarium. Another game no, another item that we'd probably need are a variety of board games because then this would promote structure and teamwork amongst the family. It could also ease the tensions as they focus on the games. Another material that we may need, that we will need, are puppets, which can promote emotional expression. So for the therapeutic space, we would need to have some furniture for the children, like such as a small table and chairs, as well as table and chairs for the adults and the therapists to be on. Bookshelves would be good to have for the books and other resources, a puppet stand, a dry erase board to note the activities that will be going on through the session, as well as a rug or mat for the children to sit on. So, in attachment focused family play therapy, the families will focus on co regulation, attachment, and reciprocity through play therapy. Through play and the therapist's guidance, the change will occur when the alteration of attachment patterns, emotional regulations, and relationships evolve in the family system. So the focus is really on the here and now of the family's relationship by practicing the three things: co-regulation, attachment, and reciprocity. But I can also focus on the past, such as any traumatic events which has influenced the present dynamics of the family. So for the treatment process, there are four phases for this model. The first is observational assessment, and I'll be going over this a little bit more in depth later on. But the observational assessment is where the therapist primarily gathers information just by observing. They take a step back. They try to see where the issues lie and what their treatment goals can be. The second is the safety and engagement phase, where the therapist builds rapport with the families, and they create a safe space to prepare the family for any for the changes. The third is realignment. It's where the therapist starts to facilitate the change process within the family. We will also facilitate attachment-based parenting skills. Um, and then the last one is attunement and termination. We would be reinforcing positive changes. The therapist would help make the parents feel confident utilizing family space and the three R's. We prepare to terminate the sessions and make sure that the parents are more confident after the sessions have been completed. So for the types of interventions, it does go back to the four phases. So in the observational assessment phase, the intervention that we'll be doing is just giving them low stress and open-ended play therapy so we could observe and watch patterns of interaction and watch the parent family structure to form a hypothesis. The intervention for the safety and engagement phase is to start building rapport and making the family comfortable and making sure to teach them emotions, through interventions such as interventions with emotional UNO, and the realignment phase, which is the longest phase of the treatment, um, since we will be focusing on change patterns and improving interactions. We want to be able to include communication skills and developing emotional regulations. So games like family poetry can be used. And then in the last stage, our intervention is to make sure to reinforce these behaviors. So activities such as body drawings, where each family member adds positive statements to a family member's body drawing, is important. We want to be able to have the family feel more comfortable in their new role. Diversity, privilege, and social location should be considered. With this theory, cultural considerations should be discussed prior to treatment. So just getting a background regarding the family's culture would be a good idea. The therapist should also integrate multicultural art supplies, games, books, and toys when working with diverse families. For example, sand tray figures, figurines can depict people from different cultures, and it's important to have that in your collection to allow family members to access symbols that represent them. Integrating these toys will allow therapists to provide a therapeutic environment that's respectful to diverse individuals. Spooner also suggests that when working with immigrant families, it's helpful to use a framework of assessing acculturation within families and helping family members to navigate their differing acculturation levels. We should also keep in mind of different parenting practices in other cultures, and it'll help us understand what may not be acceptable in American culture. We should also provide psychoeducation to the parents about mental health, trauma, and attachment with sensitivity to the cultural practices of the client's country of origin. There should be legal and ethical considerations when utilizing this model. Of course, confidentiality is first and foremost. Informed consent is needed regarding the therapy as it's very profound and emotional, especially when talking about trauma. All parties must understand what's going to happen, and the therapist should encourage the clients um, to ask questions about the process so that way they're well informed. Um, we should also inform them of us being mandated reporters. If we suspect any abuse, that we do have to report it. We should also let them know that these legalities still apply also in a telehealth setting. With telehealth being the norm, we should also consider alterations for attachment-based play therapy. Utilizing telehealth has been easier for families who are too busy to come in or those in underserved populations. Families have also increased satisfaction due to the convenience of online services, and symbolic play can still be attained through telehealth. So, for example, there are activities such as sand play therapy online and board games that can still be attainable for clients. To further my proposal for this theory, I've included research regarding the efficacy. Um, Diamond and al. Stated that based on 15 years of research, attachment-based family therapy is now listed on the National Registry of Empirically Proven Practices. They also stated in comparison to enhanced usual care, youth that have been treated with this therapy have exhibited significantly greater and faster reductions in suicidal ideation during treatment. There are other studies that I've mentioned here that do show that attachment-based family therapy was effective in suicidal symptoms. The studies show that the suicidal symptoms have decreased. So to summarize why I would like the attachment-based family play model to be utilized in our facility, the model is based on, again, three components: neuroscience, attachment theory, and family systems theory. And it's really very beneficial to the children, and as children thrive when they have a positive, loving relationship with parents that has structure and limit setting. The theory also focuses on the here and now of the family's relationships by practicing co-regulation, attachment, and reciprocity. And overall, the attachment-based family therapy model can foster growth in attachment patterns, emotional regulations, and in relationships. Thank you for your time, and I hope you all have a great day.